The Minnesota Path to Value project is supported by a grant from the Minnesota Department of Health, Office of Rural Health and Primary Care. The purpose of the project is to provide multi-year technical assistance to selected Minnesota critical access hospitals and their communities to improve population health by sustaining an integrated clinical and community-based care delivery model. Technical assistance included education, webinars, peer-sharing calls, and group workshops, all combined with individual on-site community planning events to develop customized solutions to improve the health and well-being of the community.
Ely is a town of about 3,300 people, literally at the end of the road.
With our seasonality, we have to plan and budget for 2 different hospitals. In the winter months, when it's cold and not a lot of people choose to be here, we obviously have lower censuses, and we have our operations have to change just because of the amount of supplies we need. The type of patients we see change. Our selected population for the Minnesota Path to Values project is individuals that may have behavioral health issues or concerns or has some substance use. It always came up in our community health needs assessment. It was always number 1, but no one really had an idea what to do about it. We're sending a lot of behavioral health patients out of our community to get the services that they need. We send ours into hundreds of miles away. One of the areas of improvement was receiving those individuals back into our community when they were discharged from those facilities. We saw a huge gap in that we didn't know when they were back here, and those discharge teams in those facilities did not know about what services we had to receive them back into our community.
The project caused us to do a deep dive into our current processes. We realized that our initial intake, we needed to be sensitive to diversity, equity, inclusion. Also, we realized the importance of having a referral process for our social worker. And so she is able to serve them immediately or when she returns as quickly as possible.
A major part of the strategic vision that has come out of this project is really to create those workflows and also to get the right people in the right places. You know, we were able to add Linda as a social worker throughout this project.
We're very lucky in that there's other nonprofits. We're all working towards the same goal of improving services, knowing and having that collaboration with community partners and knowing those resources better. I've been able to connect patients, introducing them and kind of doing a warm handoff.
So efforts made from my standpoint as a nursing services team lead has been education of my staff regarding specific intakes on social determinants of health, having that thorough screening when they are admitted, when they do present with a problem, but also having the knowledge to attach them to the proper resources upon discharge with the end goal of keeping them out of the hospital and having them successfully integrate back into the community. The largest efficiency that I see within this project has been the identification of the social determinants. Having that knowledge and the identification early is allowing us to get resources to that patient on a more real-time basis, saving them repeat visits to our emergency room, saving them money, ultimately saving us money.
We actually learned a lot more about the diversity that is here that is beyond skin color. It's some of the social needs that we are definitely looking at with these types of projects are food insecurity, housing, technology barriers, transportation barriers. Just being rural ourselves can be a barrier for us at times.
Community members look at the hospital as a welcoming place to come if they're struggling. So internally, it's helped our culture, looking to be one of the main supports for people with behavioral health. We have, like others, lots more that we could do, but it's a start in that direction of refining and offering more.
We have also been able to strengthen our communication with local law enforcement and local EMS.
We're part of the community. People know that we're a trusted source within the community and that we can do a lot of great collaborative work with other organizations within the community. Measurable outcomes, we will be going back and looking at the data again to see if those ED readmissions have happened the way that we hoped that they would happen with this project. And a non-measurable outcome, I think, is the cohesion of our team. We've really come together to really work on and complete this project. I think the biggest catalyst for us to do the Minnesota Path to Values project was to get that technical assistance and to really have someone walk side by side with us through a population health project.
I already knew this, but it really emphasized change is slow.
I am personally most proud of the growth of our entire team. And the growth showed up in long-term financial solutions for our organization.
Large projects seem great on the surface, but once you get into them, the details and the work become overwhelming. And when you do small pieces well, all the small pieces will add up to the large picture. If you're able to focus on something attainable, you will have more immediate success and better outcomes.